Today we are going to learn how to use our periodontal probe. Once we have corrected our position and the patient's position, we are going to start on sextant 1 on the distal buccal. Prior to beginning on the distal buccal, you can sit in one of two positions. You can sit at 8 o'clock, and whenever you sit at 8 o'clock for sextant 1 on the buccal, you have to lean over the patient to the side with your elbow across the patient. If you're going to sit at 9 o'clock, you're going to be in a V position with your belly button across from the patient's mouth. You're going to lean forward with your elbow out, still in the same position as you were at 8 o'clock, over the patient's chest. Once you have confirmed the position that you're going to sit in, the next thing you're going to do prior to beginning is checking your grasp. So for your grasp, the first two fingers would be your thumb and your pointer finger. These two fingers are going to make a C shape. Your third finger, your middle finger, is your tactile sensitivity finger. That finger is going to rest next to the shank of the instrument. Your fourth finger is your fulcrum. This finger should always be straight and sturdy. Your fifth finger, your pinky, should just be tucked because it does not have a job. Once you have formed your grasp and everything is correct, you're going to fly in. Whenever you fulcrum, you can fulcrum on the occlusal or toward the lingual cusp because we are working on the buccal of sextant 1. Whenever you fulcrum, you should be 1 to 2 teeth away from the tooth that you are working. Whenever you are ready to begin probing, you're going to come in to the distal line angle, and you are going to take small steps. For this purpose, we're going to stay at the gingival margin until you get to the distal of that tooth. You're going to slightly turn your probe so that you can follow the curvature of the tooth to get an accurate reading, and then you're going to come forward. Again, we take small steps so that we do not miss a deeper pocket depth. When you're in those interproximal areas, it is important to make sure that you tilt that probe slightly so that you can follow the curvature. Once you're finished with that tooth, number 2, we're going to move forward with our fulcrum. We were here, and I'm going to pick up slightly and move to the tooth forward of that. And then I'm going to come back to that distal buccal line angle of number 3, where I'm going to begin walking into that interproximal area. Again, I'm going to tilt that probe slightly, and then I'm going to continue probing forward. I'm sitting at 9 o'clock. My patient's head is turned slightly away from me, and my patient is in a supine position. When you are working on the maxillary, it is important to make sure that you are palm up and that you don't slip. When you are moving to sextant 2, you are going to be sitting at 11 o'clock, continuing your neutral working position. Again, our fulcrum is straight and sturdy. We have a C grasp. Our middle finger is on the shank of the instrument on the side of it for resting, and then our pinky is tucked. We're going to walk back into that interproximal area, slightly tilt the instrument so that you can get your reading, and then walk forward. Patient's head is still slightly turned away. I'm going to slowly move my fulcrum forward as I move forward. prior to beginning the probing depths for number 9, we are going to take the patient's head and move it slightly toward the clinician. We are going to check our C grasp again, make sure we're in that modified pin grasp. We're going to come back, continue sitting at 11 o'clock with our fulcrum, and then we are going to continue our probing depths. The purpose of doing a periodontal chart and using the periodontal probe is to ensure that we are finding any areas of disease, whether it be gingivitis or periodontal disease, and so that we can better educate our patient. Once we have completed number 11, we are going to use our mirror. Whenever we retract, we are coming into the mouth, and then we are coming next to the cheek and turning the mirror so that we can continue seeing those teeth. We're going to continue sitting at 11 o'clock. We are going to keep the patient's head turned slightly towards us. It is important to note that we are not turning that patient's head very far. It is a subtle movement. We sit at 11 o'clock for this sextant to ensure that we keep that neutral working position. So it is important, again, to use our mirror so that we can properly see where we are working.